Hi everybody, my name is Deniz Mevlevioğlu and I'm a PhD researcher at University College Cork, Ireland. Today I'm here to present to you our study titled Visual Respiratory Feedback in Virtual Reality Exposure Therapy, a pilot study, co-authored by David Murphy and Sabin Tabirca. The current research is a preliminary experiment to inform a larger scale study on the usability of the materials. The main study aims to bring visual respiratory feedback into virtual reality exposure therapy to aid in relaxation. Exposure therapy is a cognitive behavioral therapy method for treating anxiety disorders such as generalized anxiety disorder, specific phobias, or post-traumatic stress disorder. Exposure therapy for treating specific phobias works by coupling the feared stimulus with relaxation techniques and gradually increasing the exposure to the stimulus as the patient becomes more comfortable with it. Virtual reality makes it possible for the users to face their fears in comfort without being close to it. For the aim of this study, the development of a system that includes two components is necessary. First of the components is an immersive virtual reality experience with spatial audio, haptic feedback, and respiratory feedback. It includes two scenes. The first scene is a relaxing nature scene where the user gets used to the environment and receives instructions. The second is the main elevator scene that delivers the feared stimulus, which in this case is height. The second component is a system that records the heart rate, electrical brain activity, skin conductivity, and breathing rate of the user. Here you can see a screenshot of the nature scene. This scene also serves as a safety stage where the user can fall back to if they feel too stressed in the elevator scene. Thus, it includes elements that many people find relaxing, such as trees, flowers, sound of the wind rustling through the leaves, and soothing music. Here are two screenshots from the elevator scene. The user can see the city below them as they ascend, and using the big red button, they can take control of when they want to go to the next level, as long as they have spent 45 seconds in the current one. Equipment used during the experiment include an airflow sensor prototype to record the breathing, MindPlay brain band to record brain activity, Shimmer GSR and PPG devices to record skin conductivity and heart rate, and HTC Vive to display the simulation. These devices were chosen to provide the most mobility and to avoid brain immersion. Physiological signals of the users are recorded, and the correlation between height and arousal is used to determine whether the environment is immersive enough to deliver a similar effect to height in real world. Arousal here is predicted by skin conductivity. Correlation between different physiological measures is analyzed to assess the reliability of these measures. In this study, 11 participants were recruited from University College Cork campus on a voluntary basis. The mean age of the participants was 23.9, 4 participants were female, where 7 were male. The results showed that there was a positive linear relationship between skin conductivity and height. There was a weak positive correlation between heart rate and skin conductivity. However, there was no relationship between beta to alpha ratio of the EEG bands and either heart rate or skin conductivity. The users indicated that the haptic speakers made the experience more immersive. In the scatter plot here, you can see the skin conductance values measured in microsiemens and virtual height values measured in meters of all the users. It was found that the airflow prototype device wasn't very reliable in capturing the user's breathing, and for the continuation of the study it needs to be adjusted or replaced with a different device such as a respiratory belt or electrocardiogram. Based on the user feedback, the amount of on-body sensors might cause some discomfort on the users and affect the immersion. The EEG signal was quite noisy, so it might be beneficial to use a wet node instead of a dry one. In conclusion, the environment was found immersive enough to deliver the desired effect. For the continuation of the study, arousal levels of a group with respiratory feedback versus a control group will be examined to determine if respiratory feedback has a positive or negative effect on the user's arousal. Thank you very much for listening, and please feel free to ask me any questions that you might have.